Pertussis, also known as whooping cough, is on the rise in Gallatin County. So I'm here at Billings Clinic Bozeman speaking with officials on who's at risk and what you can do to protect yourself.
It's called whooping cough because at a certain phase in the illness, people will cough so hard that they take a deep inhalation that sounds like a whoop, almost identical to when somebody has a near drowning and they come up for a breath of air.
Claire Kennemore has been a pediatrician for over 27 years, treating some of the individuals most vulnerable to pertussis, babies and children.
It's so contagious. I have a little toddler in my practice who is not vaccinated, and he caught whooping cough at a park. He was outside, so it's extremely contagious.
As of November 12th, Gallatin County Health Department reports 31 confirmed cases of pertussis in the county. But Lori Christensen says an uptick can be seen nationwide, according to the CDC.
The United States has recorded over 16,000 cases of pertussis in 2024 so far. This is a significant jump compared to the 3,700 cases reported during the same period last year.
Kennemore says that more and more people are opting out of vaccination, and even more adults are unaware of the necessity for a booster for those already vaccinated, which may explain the sudden increase in illness.
So the vaccine does have a tendency to wane or lessen its effectiveness over a period of about 10 years. And so people will have a cough and not recognize that they're carrying pertussis because they're partially immunized, and that's a leftover immunization from their middle school shots.
If you suspect you or a loved one is affected, don't worry, it's treatable.
While whooping cough can cause serious illness, it's also important to note that it's generally treatable with antibiotics, and most people make a full recovery.
In Bozeman, Heaven Van, MTN News.